Hello everyone and welcome to Annotated Medical Tutorials, a channel specifically designed to simplify medical concepts. So today we've got an interesting case of a 6 months history of a digital ganglionic cyst, aka digital mucus cyst. So we're going to be performing a surgery, but before we do that, some of us might have a lot of questions, including what exactly is a ganglionic cyst, what causes it, and what are the treatment options available. Does it have any risk of recurrence after treatment? So one point that I need to emphasize here is that a ganglionic cyst is not a cancer. It's a non-cancerous lump that most commonly develop along the tendons or joints of your hands or wrists. It can also occur in the ankles of the feet. They are typically round and oval in shape, and they are filled with fluid that look like jelly. So most of the times they just go away on their own. They are also symptomless. But in cases of them being symptomatic, they can cause discomfort or pain due to compression of an underlying nerve. So if it's bothering you, treatment options include draining its jelly-like contents with a needle, or a surgery to remove the whole cyst can be performed. So the causes of a ganglionic cyst are not known, but it's known that it grows out of a joint and the lining of a tendon. It looks like a tiny water balloon on a stalk, and it seems to occur when the tissue that surrounds the joint or the tendon bulges out of place. So here are the risk factors of ganglionic cysts. We've got age and sex. We know that ganglionic cysts can develop in anyone, but it most commonly occurs in women between ages of 20 and 40. We've got osteoarthritis. People with both osteoarthritis in the finger joints closest to their fingernails have got a high risk of developing ganglionic cysts near these joints. So another risk factor is a past history of a joint or a tendon injury. So if a tendon or a joint has been injured in the past, it has got a higher risk of developing a ganglionic cyst near it as compared to the non-injured joints or tendons. So in this case, we've got a case of a 6 months history of a ganglionic cyst that has been symptomatic. It has been causing discomfort, and the patient requested a surgery so that it can be removed. So we are going to be performing it, starting off by doing a digital block, in order to numb the whole finger. after suturing, the wound is dressed up and the patient is started on prophylactic antibiotic treatment. This is to avoid infection to the wound site. And also the patient will be given some anti-inflammatory drugs to avoid pain and swelling. If you find this video helpful, please consider subscribing to our channel and click on the notification bell so that you can be notified when I upload the next video.